This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 13 in a 58-part video series of the entire book, chapter by subchapter. If you have not already, please review the introduction video. We will cover this section on taurine. Taurine is a major amino acid that's typically found in very high concentrations in the heart. Even popular energy drinks like Red Bull will have 2,000 milligrams of taurine. Some researchers do not understand how taurine works to help congestive heart failure. They do know it improves left ventricular function and lowers blood pressure by calming the central nervous system. The human body can manufacture taurine in healthy individuals, but under illness and aging conditions, it is necessary to supplement and take extra taurine. Taurine reduces lipids and other chemicals that are major risk factors of heart disease, and young athletes use it to decrease body weight and increase their energy. Myocardial energy declines in heart muscle tissues with low levels of taurine. Taurine basically modulates the cellular intake of calcium. When the Japanese clinical study conducted in the 1980s carried out a double-blind crossover trial to treat congestive heart failure, they showed a significant increase in energy. A study released in 2011 reported that increased exercise capacity in test subjects was noted with just 500 milligrams per meal 3 times each day. In several clinical trials, dosages have averaged 2,000 milligrams per meal 3 times per day, and these trials were focused on treatment of heart disease and cardiomyopathy. Because taurine crosses the blood-brain barrier, it also affects the brain and increases neural pathways and regulation. The dosage in this book begins at 1,000 milligrams 3 times each day, or half the amount followed in the clinical trials. You can work up to 2,000 milligrams 3 times per day later as you see how well it works. Some side effects have been reported, such as dizziness, so just take the minimum that you need to take and see how it works. In summary, judging from the clinical trials conducted on serious heart failure patients, taurine is a critical amino acid, value 1, and very important for heart failure recovery. Magnesium taurate is a carrier for more taurine in the bloodstream, and excess taurine is removed by the kidneys. So extreme quantities used by athletes are often removed simply by urination. This concludes this part. I'm J. Randall Wilkerson, author of the Heart Failure Recovery Plan. This book is available at Amazon in print and Kindle editions, at Apple iTunes in the iBooks store, on eBay in print editions, and from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24 for the book and shipping. Thank you for listening.